Hey, good evening. Dr. Alan Christensen here with you. Nice to see everyone. We got a really good group here tonight. So this is one of our latest installments for the new version of Office Hours Live. And really glad to connect and happy to talk about hypothyroidism. The symptoms behind that, some solutions, what to do to make a big difference. And yeah, I got a lot of great questions sent in already. And I've got a few slides together. I got kind of a topic in mind, and I've woven the questions into those. I've also got a few more I've put at the end, and we'll take some live questions too. So yeah, good to be with everyone. I see some hands up already. Totally got the right idea. You're welcome to raise your hands during this, and I'll use that to find live questions. I'm going to drop a link in the chat. If anyone is not sure how to raise your hand in Zoom, that will tell you how to do so. So there, this is from Zoom support on how to raise your hand in a Zoom meeting. So yeah, lots of good questions sent in. We'll cover those. Someone asked about just how I was, about my recovery. I'll mention that real quick as more coming on. Yeah, thank you for thinking about me. If you didn't know, October of 21, I had West Nile meningitis and just about didn't make it. Not to be dramatic, but that's true. And now I feel like I've pretty well recovered. My legs I still got a few goofy nerve signals more so, but I'm running pretty well again and hoping to qualify for Boston in June. I'm going to run a marathon in Minnesota and wish me luck. So that's the excitement. I feel that mentally I've come back. Oddly, I know that I can't judge that accurately, but Kieran assures me that good or bad, I'm wherever I was before. So there's that. But let's get on and start talking about hypothyroidism. My slides going here with you guys. So this is kind of a hybrid between the older office hours and the and more formal webinars. I wanted to kind of weave those together, and I wanted to get it to where we could just talk in person. And these are great because I can pull you in and just talk in real time in video. So I'm going to speak for, 10, 20 minutes, maybe a little bit more, and leave time for your questions and live discussions. I'll talk about medications, supplements, food, and then comorbidities. That's a clunky term, but it's other things that go along with thyroid disease that go under the radar. I put medications first, and I put a lot of thought into this. They're not the most important necessarily, but they can goof things up the most, and they're really commonly done badly. And they're also, you're just taking a pill, so you might as well take something that's right and helpful or not be on it. And I'll talk a lot about that. Supplements, talk about the way in which they can make a big difference for hypothyroid symptoms, recovery, the whole disease process. Food, and then the comorbidities. These are the other conditions, and I'll mention those in a bit of detail. And it's actually worked out really well because a lot of your questions were just directly tied into these topics. So I put a few in as they belong, and I'll intersperse between some prepared slides and your questions. So for starters, who does this apply to? Who has hypothyroidism? Well, as a generalization, this is something that is quite prevalent. And this is going to be affecting people. Let me get my spotlight up here where I can make notes on things. Here we go. Yeah, my vanishing pen. Cool. So this is someone who's been told they've had low thyroid, they've got Hashimoto's, or more vaguely thyroid disease. Now, there's more formal definitions. There's different levels of hypothyroidism, and I'll touch on those. But basically, somebody in these categories or someone on thyroid medication, and of course they can overlap, they can be considered to have hypothyroidism for the purposes of our discussions. Yeah, I wish diagnoses were more detailed. We'll talk about different kinds. Now, a little more depth, there's some stages of this. I think about this as like mild in here, moderate in here. I'm sorry, I said that backwards. So yeah, going downward in the stages of hypo. So more mild hypothyroidism, more moderate, and more severe. We can think of it that way. And it seems that most people who get diagnosed and put on treatment are in these mild to moderate stages. And more formally, that's been called suboptimal or subclinical hypothyroidism. And the difference between these milder stages and the moderate ones from the severe is that T4 has not dropped off. So what's going on is that at these stages, there's a louder signal than normal telling the thyroid to work. It's being yelled at more or less, but it's working. So it's making hormone, but it has to be told harder to do that. Now, we differentiate that from this more severe stage to where it's being told to work, but it can't keep up. It's not making enough hormone. It's clearly dropped off. So people can get symptoms here. We can get a lot of symptoms in these mild to moderate stages. I talked about a squirrel that distracted me when I wrote a recent email. I've got a one right now. He's right outside my door, and he's looking at the door. I put leftovers outside a few times, some food scraps, and I got fat and spoiled squirrels now. they're almost like asking for food by name. Okay, so back to the topic. But here the thyroid cannot keep up. It's not making hormones. So you can have symptoms here, and a lot of people do, but in almost all cases, the symptoms are not because there's too little thyroid hormone. The symptoms are because of the autoimmunity that can give rise to all this. So symptoms here are more about thyroid antibodies and not so much about just there being too little thyroid hormone. Once that light bulb goes off, it becomes obvious why medications seem to be hit or miss, because that's not the problem. The problem is not the body has too little of something. The problem is that there's this inflammatory autoimmune process, and medications don't help that. Now, down here at these overt stages, there's too little of something. It's just not coming out. And at this point, medications are still not perfect. They can be needed. They can be life-saving. They're still not perfect, but they at least are reasonable considerations. But the data is clear that in here, they're just probably not going to help. And there's more data saying that they're not of benefit for symptoms. They don't cut the disease risks. They don't improve health outcomes. And so let's just touch on that a bit more and get some more detail on them. And I'll cover a couple of questions about medications that were sent in. So first question is, are they likely to help you? Are you in those categories? And if you are someone to where your thyroid was taken out, you had radio ablation, in that case, you're just met by mandatory at this stage 2 severe hypothyroidism without treatment. You need medication, no doubt about that. Or here, they're not the only option. Many still can do well with dietary therapies without medication, even if they're stage 1, but medications are more apt to help. But if before you went on treatment, you were somewhere in these ranges, the medications may not be helpful. They often just are not. So that's the first big question. And if you are someone to where they are needed, or the other question is if you're already on them and you can't just it's not responsible to just stop them willy-nilly. And so while you're on them, they may as well work as well as possible. And in those cases, the questions are like natural versus synthetic. Some do better on one or the other. It's kind of a weird system here because synthetic, we think about that being a bad thing, but synthetic in this context, it's still bioidentical. So natural, many do better with what we call natural thyroid. That's freeze-dried desiccated pig thyroid, things like Armour brand, or now we also have NP thyroid. Synthetic is the T4 only, which is the most common, but some do better on one versus the other. We think too, if someone's on a dose that's optimal for them, or if it's a safe dose. What do I mean by optimal? Well, if someone needs to be on medication and they're not feeling their best, there's a lot of data saying that some do better when their medication's brought to control their TSH to a tighter range. So not just normal, which is everywhere from here to here, but to this tighter optimal range. Now, we'll cover this in some of our questions. That doesn't mean you have to be there. If you're someone who's healthy and asymptomatic, there's not a mandatory reason you have to be pushed down into that range. But if you're symptomatic and you're outside of this range and you're someone to where medications are appropriate longer term, for sure, many do better when they're at a more optimal level. And the other question is it a safe amount of thyroid medication? And what we see is that if the dose gets too high, there is a shift towards being in a hyperthyroid state. And that first correlates with the TSH dipping below range. And oddly, a lot of folks can be there and they can feel like they're getting too little. They can feel tired or weak or gain weight or have a lot of other symptoms that we would think would associate with too little. And there's times too where we question about absorption. That mostly comes up when someone seems to need a dose that's higher than you would expect, and it's still not raising their blood levels. So they're taking a lot, but it still shows you're getting too little. And these are things to sort through for those who are on meds and do need them longer term. Now, I'm going to step out of the presentation and do a couple of related questions and then come back and talk a bit more about some prepared topics on meds. So here's a great one. Leslie asked, I'm taking thyroid meds, NP, still have thinning hair, really cold hands and feet, and I live in a warm climate. You guys see out my window here, it's the second day of spring, and I've got a frozen lake behind me and about 3 feet of snow on the ground. Leslie, you wouldn't be doing well here, I tell you that. Can you explain and what to help improve it? Also, can you get off thyroid meds or do you have to take them forever? Thanks so much. I appreciate you. Thank you for that, Leslie. Yeah, so the thinning hair, cold hands and feet. Now, here's the thing. All those symptoms can come from a severe lack of thyroid hormone, but they can come from other factors. And even if they do come from there being thyroid disease, they can come from the autoimmunity. So we can see to where the antibodies can cause problems just like this. And when that's the case, the medications will not help. So with thinning hair, cold hands and feet, I always think a lot about iron levels and iron status. That's a big consideration. And also other factors. So a paradox too is that when someone is on meds and they're not needed, sometimes that can cause them to have symptoms of being low thyroid, even though they're not. So that's a thought as well. And that relates to the second part of your question, Leslie. Can you get off meds or do you have to take them forever? Well, as a generalization, those who don't have a thyroid, kind of obvious, but those who don't have one, or those to where it was ablated by radiation, yeah, they'll need meds forever in almost all cases. Otherwise, most people can take less and many can take none. I've had a lot of good success that way. I've written a fair amount about de-prescribing. I'll talk a bit more about that, but there's a lot of arguments for that. Okay, related one. This is someone who asked about my recovery, so I did touch on that. Thank you, Dana. Not sure if I'll be live in London. On thyroid medication, TSH between 4 to 5, T3, T4 in range. Is it recommended? I'm sorry, not on thyroid medication. Yes. Recommended to start replacement. Small dose, perhaps. So yeah, Dana, so you're here, basically. You're in what we call this subclinical stage. And that can affect symptoms, that can affect your health. But I'll mention in just a moment some studies. Medication doesn't help. It doesn't cut your risk of the thyroid disease getting worse. It doesn't lower symptoms. It doesn't cut your risk of other related health problems. So really no net benefit. Supplements like Nigella, what dosage at all can help. For sure, the general things that are useful. I'll talk tonight about Hypothyroid Support. That's the main thing. If you did have autoimmunity, Nigella is useful in the context of antibody support. So back to the medications. For those like Dana, we have good data saying that they're not necessarily needed, helpful, or safe. In fact, for more than 90% of cases, they will not lower fatigue, help weight loss, lower the risk of thyroid disease progression, improve quality of life, or lower the risk of heart disease. And the main point is that taking a medication is not the same as making a hormone. And that's something that, as a practicing endocrinologist for a lot of years, I didn't really register that very early along. You know, in 95, there was a group that was first forming called the American Academy of Anti-Aging Medicine. And their thing early along was all about growth hormone replacement. And their argument was that young people have high growth hormone, old people have low growth hormone. Therefore, if you give old people growth hormone, they will feel like young people. It was a simple enough argument. But the point was that if you were to take a hormone in a natural form and achieve a healthy blood level, you would be just like someone who had that blood level naturally. And that seemed plausible. But we now know the one doesn't follow from the other, that taking a hormone, even a natural hormone, even at appropriate blood levels, is not the same as making it. And in the case of the thyroid, a lot of the action of thyroid hormone goes on within the body's tissues, inside the cells and inside different tissues. And those things do not always reflect in what we see in the blood levels. So if your body is not lacking in thyroid hormone, but you're taking it in a pill, you do throw things off. And if you have scores showing that you're at a hyperthyroid state, that's obvious and there are risks. But now we know that even if you're not obviously at a hyperthyroid state, it's different than what your body would do by itself. In fact, we now have data saying that this can cause the risk of heart disease, osteoporosis. Of course, there's the cost, drug interactions, and cancer risks. So there are some risks associated there. So a couple more related questions. Can we over-supplement trying to get those darn thyroid numbers right? My practitioner, I've been tinking with a stubborn T4 number. So let me just touch on that briefly. Now, let me go back. So we think about your thyroid levels, and we got the TSH, we got the T3, the T4. Now, the T3 and T4, these things go up and down a lot. They only drop off at the latest stages. And there's a really popular argument in functional medicine that if healthy people have a low TSH, they must have to have a high T4 and a high T3. And I think that's what's going on here. Let me go back to the question real quick. That's what's going on for Jennifer. She's on some medication, she's taking some supplements, and her practitioner is trying to get her T4 on the high side of the range. Is that hard? Can you overdo that? The first question is that important? And do healthy people have high T4 levels? Do high T4 levels correlate with fewer symptoms and longer-term health outcomes? No, they don't. So that's not a goal I would encourage you to pursue, Jennifer. And please have your practitioner reach out. You're welcome to forward along their information to our team, and I'll connect with them. But healthy people don't consistently have high T4 levels. In fact, if you do achieve high T4, high T3 levels, it's almost always at a risk and almost always at the cost of hyperthyroid side effects. There's actually a paper I'm working on right now. It showed that high T3 levels, extra T3, strongly correlates with breast cancer risk, not only causing it, but causing it to grow faster. And T4, there's some similar risks. So the things you're taking, the non-prescription supplements you're taking, are safe. There's no drawbacks to those. However, those won't change your T4 or push those higher. You shouldn't have to get your T4 higher. So it's not a matter of you not trying enough. It's a matter of it being a goal that's not necessarily a useful one. And if you're around, I'd love to hear follow-up questions you might have about why they wanted that high, or if there are symptoms that you're struggling with. Another one is asking, Christine is asking about natural thyroid medication options. Too many negative side effects with levothyroxine. So Christina, right now we've got several of the products just out of the market. I hear data saying they may be back this year, before it was early this year, I don't know. And I'm referring there to WP Thyroid and Nature Thyroid. We have Armour and NP Thyroid, and there are compounded versions of natural thyroid. Those are the three options on the market. Now, Armour and NP are made by manufacturers. They're the same wherever you would get them. Compounded can vary greatly. There's no pharmacies that pay me or I'm tied to. There's one called Foothills Pharmacy in Mesa that I'm confident does do a good job with assaying the hormones in compounded natural thyroid, and also making versions that are free of binders or fillers. They actually just use baking soda, so sodium bicarbonate. So pretty clean stuff. That exists. A deeper question though, Christina, I would pull back to the prior discussion about whether you're someone that needed medication in the first place. And in so many cases, that's the issue. It often seems like it's a matter of the wrong medication, the wrong amount. And sometimes if you change a dose, it might seem to work better for a while and then just kind of lapse, not seem to still work the way it did. And often the case is that it's not that you almost had it right, it's that it wasn't the need in the first place. And there's often this way by which when you first change or first take more of a medication, your body's ways that fight against something foreign take some time to catch up to that. So for a little while, you often get past the defenses and it seems to work. And it seems because of that, like just one more try, just one more step will stay like that. But it's not. It's just that your body was struggling against it, but it took time to start struggling against the new thing. So if you're on, we're happy to talk through about what your original diagnosis was. Maybe it's not a matter of the wrong medication after all. Briefly to touch on this idea about de-prescribing, there's more and more data about the utility of this and the power of this. Big studies have shown that somewhere around 84% of people can take less, and of them, about half can take none and do just fine. Now, these numbers are already pretty good, but these numbers do not differentiate the fact that most people are at an earlier stage of disease when they're put on medication. They're often at milder forms. This number is including those who have more severe forms of overt hypothyroidism. So it doesn't include those who lack a thyroid, but it does include those who had TSH scores in the hundreds and low T4 levels. Even cases that bad are thrown into this mixture. But if we think more about cautious selection and those who weren't that far along at the beginning, and then also if we think about people that do things that can help in terms of monitoring their iodine and getting enough micronutrients, things like that, the numbers are only going to get better. So these numbers are not doing anything smart and leaving in everyone, even some people that probably couldn't have done well to begin with. And even then, nearly all can do better. So the things that do help, we'll talk about all of these, basically lifestyle, natural stuff, natural treatments, diet and supplements, nutraceuticals, foods, the stuff you can do at home. And we've got hard data showing that these are not rates of improvement. These are rates of full disease reversal. So the first step I want to talk about was the medication. I'll touch briefly on these next couple and we'll grab some more live questions. Second one is about just, good, healthy dietary change. And the most important factor there being controlled iodine. We know that adequate protein is important, that certain micronutrients are helpful. Selenium, zinc, vitamin A are big ones. And then phytonutrients. These are really cool. Someone else in the questions asked about the new book. My new cookbook is a lot about phytonutrients. And these are great because they coax the body to work better. They're not essential vitamins or minerals. They're not proteins, fats, or carbohydrates, not even fibers, but they're things that almost trick us into being more effective and more efficient with our chemistries. And these can be used in strategic ways to improve thyroid function. And those are the main 4 points that went into constructing the food lists and the menu plans in the thyroid reset diet. I've talked a lot about this and about other diets. I won't spend much time on this right now. The third step to touch on, I mentioned before, was the comorbidities. So these are the things that often go along with thyroid disease. They're not thyroid disease, but what they do is they often worsen the symptoms and they correlate with it. So two here, I just want to highlight overweight and fatty liver. These are so common, and we often don't think of them as even being present. Or in the case of weight, we don't think of it as being a cause of symptoms. But this is a huge driver of symptoms. Honestly, almost nothing raises inflammation in your body more than toxic fat in the wrong place. So if you're not feeling well and it seems like it's a matter of the wrong thyroid dosage or whatever else, it may just be that. Or it could be any number of these others. There's a dozen here, but there's at least 15 that are very common. And by very common, I mean that more than 5% relationship between them and thyroid disease. Some of these, it's like 80 to 90% relationship. So very common things, adrenal health, parathyroid disease. I just talked to someone a week or so ago that had some serious symptoms. She was actually just a friend of a friend, and she was struggling, trying to figure out why her thyroid was causing her the anxieties, other things. And I said, look, just forward me your labs. I'll just give you some ideas and refer you to a local doctor. And her calcium levels were 11. They were blatantly elevated, way above the range. And likely she has parathyroid disease. And it's a great thing to catch. I think she'll do much better from resolving that. Diabetes, diabetes and prediabetes, that's now 51% of the population. But you have very, very common things. And briefly, last point, step 4 would be supplements, appropriate micronutrients, right ones, not too many, but targeted ones in the right amounts. We have good data relative to hypothyroidism showing that they can make your thyroid produce hormone more effectively. They can keep the cells from being damaged, and they can improve key symptoms. They can help the body's energy metabolism, help the basal metabolic rate. Now, a couple of related questions sent in advance. This was a great one. I was glad to hear. Tina, her endocrinologist, was concerned about ashwagandha. So I'll mention about hypothyroid support. One of the ingredients is Withania somnifera, which is the Latin name for ashwagandha. Ashwagandha is Sanskrit for smells like a horse, kind of a funny name. But she read that ashwagandha contains steroids and steroidal lactones. Can this aggravate oral thrush? Was told by ENT that steroid gel can feed thrush. Not sure if it's the same. Endocrinologist was concerned about it as well. So ashwagandha, way back when, there was a couple of mouse studies suggesting that ashwagandha was like Miracle-Gro for the thyroid. And they were almost too dramatic in terms of what they did, and also not realistic. So they did things that wouldn't be plausible for humans. And it made it to where it was almost worrisome that it could cause hyperthyroidism. Human studies that were done later showed that this was not the case. It can have a regulatory effect. It can be helpful, but it doesn't overstimulate the thyroid. Now, the term steroid is a term that I wish we could just start over on because it's so loaded. And Tina, you're totally right. There are a lot of oral steroids or even like systemic steroid shots that suppress the immune system. But steroid is a massive category. It's like people, like to say people are good or people are bad or people are musical. Well, some are, some are not. But steroid is as broad of a term. And there's steroidal lactones, which are compounds found naturally occurring in a whole lot of plants. They have nothing to do with prednisone or Kenalog or the kind of steroids you're concerned about. So simply no worries whatsoever that way, just not even related. And then a related one to the early discussion too, Margaret, is there a normal different TSH for everyone? I hear that if you're on thyroid meds, she's on Armour, TSH should be between 1 and 2. However, I feel hyper when it's that low. So Margaret, first thought is, where were you before diagnosis? You might have never needed them. And it's actually really common for those. Many people who didn't need them still can take them and not have those reactions. But a lot of people do have reactions like that. That's not common if someone had more severe hypothyroidism. But further though, what's called an optimal TSH, that's more so an opportunity. So if someone needs meds long-term and they've got symptoms or feeling badly in some way and nothing else explains them, and say their TSH is 3, then for sure they could consider lowering that if they felt better with that. But you wouldn't need to. You would never take someone who says, hey, I feel fine, I'm healthy, things are good, and say, no, we got to give you more because your TSH is too high. No, it doesn't work that way. There's no health risks from it being above there. It's an opportunity for someone who doesn't have resolved symptoms, but it's not something you have to do for other purposes. So I'm really glad you asked that. And to wrap up the discussion on supplements, just to talk about the new blend that came out, I'm excited about this. This was a real core part of the formulation that I wanted to have from the very beginning. So I did a literature review and I wrote the Thyroid Reset Diet, and I saw about, 500-600 studies on nutraceuticals and thyroid function, and many showed benefits for hypothyroidism. And I wanted this one to be part of the mixture. So a couple of these things are overlapping on purpose with the thyroid daily, these 4 specifically. There's a base amount that's good for anyone with thyroid disease, but there's arguments for higher amounts targeted for those who have hypothyroidism. So it's augmenting vitamin A, riboflavin, folate, and copper on top of the amounts in the thyroid daily. And the reason is that vitamin A makes TSH receptors more responsive in these higher doses. Riboflavin also has anti-inflammatory effects. We see some benefits to methylation, but there's other things that are not present in there. So valine, for example, there's quite a bit of data saying that valine is lost more readily in hypothyroid states. And a lot of the benefits of dietary protein hinge upon bioavailability of valine. So this benefits basal metabolic rate, body fat breakdown, muscular growth. With anemia, we have good evidence about it being of use for metabolism and energy output. This is methylsulfonylmethane, kind of a cool thing. But so your body makes T3 and T4, of course, and you also get that from medications if you're on that. Well, most of those are left in a strategic oil reserve of sorts. They're kind of left in a savings account, and they're bound up with sulfate compounds. So at any given point in time, 80% of these hormones are bound up in sulfate compounds, and MSM helps the body make better use of them. So it's kind of like you're driving along and you got a flat and you need 2 spare tires. Well, there actually was a second hidden spare tire you never knew about. It's like a bonus thing. And that's what MSM does. It helps your body tap into these stored versions of thyroid hormone that you couldn't use that well otherwise. So that's the purpose of the blend. And we've got a promo going on right now because I'm just rolling this one out. You can get this now at 20% off currently. It now is available. It now is shipping. The code is at ACHS20, and I'll drop that and the link to this in the chat here. And once I get that done, we will jump on a few live questions. Okay, where did the chat go? Here it is. No, it disappeared on me again. Here it is. Ha. Okay. All right. So this will go out. No, my drawing pen is not cooperating. Okay, I got to get rid of my drawing pen. No. This is pretty silly. Okay, well, let's see. I've got to stop my spotlight. And there it goes. No. Maybe if I make this go away. That's the trick. Okay. And we'll get this out to everyone here, everyone in meeting. And there's the code and there's that link. So yeah, really, in terms of micronutrients for hypothyroidism, this was the blend, and I chose the ingredients and the amounts for those purposes. So I covered some of the ones that were sent in advance. There's a few more I'll reply to directly, but I wanted to grab some live questions tonight as well. And I saw a lot of hands up, and this is always fun to get them live. If you can be on video, that's even more fun. It's nice to talk in person. And so let me get the participants list up, and here we go. And here's the hands. Okay, so they just show up in order. I'm just going to go through the order that these are here. And if you've got a question now, you can still raise that and get a few more in. I'll cover as many as I can. And Lynn, looks like you are up first. So I'm going to ask to unmute and then lower your hand and just get yourself unmuted and start talking. All right, go for it, Lynn.
Hi, can you hear me?
I sure can.
Okay, great.
Go.
So I found you in January, and I was so grateful because I was just about ready to start a parasitic cleanse and then also a liver detox, and the supplements were all full of iodine and some.
Oh no!
Yeah. So I had them, but I haven't used them. I was started on MP Thyroid with just a whisper, 15 milligrams for 25-pound weight gain, fatigue, insomnia, cold sensitivity, and a nodule. And they said that that would help. My TSH was in the very, very low twos at the time, and my free T4 and T3 were both within range.
Okay. So let's just pause and expand upon this, because this is so classic for what I was saying. So you weren't feeling well. You mentioned some symptoms. You had a nodule. You mentioned the weight concerns. And these are all things that yes, severe hypothyroidism could have caused or contributed to. And then also autoimmune thyroid disease can correlate with as well. So the thyroid could certainly be responsible for these symptoms, these issues. And it can be so logical to think that if that were the case, then if we just throw more thyroid in the system, things will get better. That seems so logical, but we now know it's just not true.
So I went from that to a functional medicine doctor because nothing was working. And he said, well, you're not taking enough. So they increased it even more. And I felt worse. So I've had the nodule because it became quite painful, actually. And I've had FNA biopsy, and it was benign. And then I've also had it scanned every 3 months. So it's had just a very slow growth. It is solid, but I'm scheduled to have it scanned again in 3 to 6 months. However, since finding you and reducing iodine, and it was in everything we were using. Our shampoo.
So what were some of your shampoo?
Well, so we're pretty holistic and try to use natural things. So I had a seaweed shampoo, body lotion, body wash. We had a Colina yogurt it's thickened with agar or agar. I'm not sure how to say it.
I didn't see that very much anymore, but it's still around apparently. Okay.
Yeah. And it was in our multivitamin, even though it was, a natural, was taking the wrong B6, everything. So I have devoured all your webinars and your books, and I've started the metabolism reset, but I reduced all the iodine. And I mean, it was a pretty drastic reduction, just getting rid of all the topicals and the multivitamin, and then also the egg yolks and things like that. So my nodule is no longer painful. super excited about that. And I know I want to ask a question here. And I'm also doing a sleep apnea study. So it's, I suspect a mild sleep apnea, but since starting the metabolism reset diet, I've lost 8 pounds and 1.5 inches off my stomach.
That's so cool.
Yeah. So I'm just using the pea protein and the plain pea protein and the RS, the complete RS. And the reason why I chose that is because I wanted to add my own things into it, and I don't really care for stevia. But sure. We're going to start traveling quite a bit, and I was wondering about the shakes. Are they non-GMO as well?
They are.
Okay. And then I wanted to ask you, I'm taking the nodule control because I have 2 nodules that are problematic, but the pain has gone. So I'm grateful for that. And then I'm also taking the bundle, the Thyroid Daily, and would the hypothyroid be something I need to look at, or should I just go along with this for a few months until I have more?
At the very beginning, what were you saying about the symptoms again?
So I had 25-pound weight gain all in the middle, cold sensitivity, insomnia, hair loss, which I've got a lot of hair, but I was losing a ton of hair. And that was also I had COVID early on, and I lost a lot of hair around then. So I don't know if that's the same. Then my eyes were really dry and red in the morning. Okay. So those were my symptoms.
In terms of the symptoms and in terms of overall output, you weren't really hypothyroid going into this. You weren't low, you weren't lacking. And arguably, you could see perhaps some greater benefit with some symptoms like the metabolism with it, but I think you're making some good progress. I always like to do things as focused as possible. So I'd say stick with what you're on.
Okay. I just want one last quick question. I've gradually come off the MP thyroid with my endocrinologist. He was doing the nodule scans. He's, why are you taking this? You don't need to. So I reduced it. The nutritionist I started seeing about the diet, who was also going to have me do the liver detox better with the high iodine things. She said, you don't really need this. And so I went off of it very gradually under supervision. And I've just had my numbers tested. So my TSH is now, with nothing, is now 2.32. Mm-hmm. And it's basically what it was when I went on it. And I feel better. And then my free T3 is 2.7, and my T4 is my free T4 direct, it says, is 1.36. Is that all?
Those are all perfectly normal. Yeah.
Okay. Alrighty. So don't add the hypothyroid right now.
You wouldn't need to.
Okay. And if I get the shakes for the travel, would I add in the RS?
Yes.
Okay. Alrighty. Okay. Thank you so much. I really appreciate you.
That's great. I'm glad you're doing well. Thanks for your questions.
Thank you.
Okay. Let me grab next up here, my participant list, get that back up. And Zoom is goofy sometimes. It's probably not. It's probably just me being, here we go. Yeah, this one list comes and goes. Okay, if I click back here. So now I can't see the hands in order anymore. Well, I can go up this side as well. And anyway, there's Joanne, and Joanne's got her hand up. So that's easy. I can go from this side. Hey, Joanne, how you doing tonight?
Good. How are you?
I'm doing great. Nice to see you.
You too. I am missing my weekly Mondays with you.
I'm going to do something kind of like that more frequent again. I'm playing with that. I'm busy with project, but I want to get something like that happening again. I'm missing those too. Thank you.
All right. Well, good. I love this one-on-one connection where I can actually talk to you, but I do miss that weekly check-in. So for what it's worth. Okay. When we talked last month at the Zoom, I was getting ready to start the de-prescribing regimen, which I did start. Okay, so here's what happened. I've been on a 3/4 grain dose for forever. Well, 5 years. And Dr. Espinal planned 12 weeks. We were going to take it very slow over 12 weeks and go from quarter grain to half a grain. So just a minute step back. So she said to watch out for, fatigue, hair loss, sleep issues, feeling cold. The only thing I had were heart palpitations. But into week 5, they were getting worse and stronger, to the point I was having heart palpitations all day long. So my question to you is this telling me I'm not a candidate and I should not? I went back to my regular dose at week 5. Is this telling me I'm not going to be able to get off meds, basically?
No, it doesn't.
Really?
Yeah.
Because I was just like, my heart was like thump, 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 thump all day long. And I thought, I'm not supposed to do this. It kind of scared me. Basically.
This is a weird paradox, but part of de-prescribing is your body can also start to over secrete. It can happen to where you're making more quickly. So some people need to pace it to manage hyper symptoms as well. But but when that happens though, that's the opposite of saying it won't work. It's saying it's working. It just takes time, takes a gradual approach.
Yeah, I guess hair loss, feeling cold, fatigue, I'm like, meh, I can deal with that. But when your heart's not pumping right, that's a little more scary. So at week 5, I did go back to my standard dose.
Well, an easy trick you can do is from the standard to the reduction doses, you can alternate days with those to make it even more gradual. But that means you were making progress.
So that means I was actually making progress.
Yeah.
So I should start over.
Yep.
I should start over. Okay. All right. Well, I will throw a curveball in here that I will tell you. Okay. About 2 weeks before I started the de-prescribing, it lasted for about an hour. It was 11:30 at night, and my heart just started racing and wouldn't stop. I've had a couple of brothers diagnosed with AFib, and I think it could have been an AFib episode.
I was also going to say it could be unrelated. There's that too. Okay.
So I guess my fear here is I have a visit with a cardiologist in about a month, earliest I could get in.
Yeah.
So should I not do this? Should I wait till I see the cardiologist? The two maybe aren't related, go back to the de-prescribing. So the heart palpitations were scaring me, but maybe you're saying that was actually progress.
It was progress. Yeah. You could resume, you could take it more slowly. Do follow up with your cardiologist, but you won't hurt your heart by taking less thyroid.
Really, even though I was, okay, so I could go back and try it again. Mm-hmm. Okay, wonderful. One more question, please. The last Zoom we had, I'd mentioned to you, I'd been back to the gym 3 days a week. I had been having continual bone loss with osteoporosis, but after 3 years at the gym, my DEXA came back no change. And you said the no change was actually better than no change. So can you explain that again, how no change was actually better than no change?
For sure. Oops, let me get this back up real quick. There we go. So I'm going to draw this. Basically, what we expect, I'm trying to get to where I can see what you're seeing. So I'm going to change the screen a little bit. And there we go. Now I can see what you're seeing. So what we expect is that bone loss drops with age, right?
Okay.
And that's a pretty dramatic line. Let's put some numbers on there. So here's like 40, 50, 60, 70, just to make a point. So that's just a normal change. And let's say that your bones were thin, they were here. And now let's say, to make this more dramatic, say 10 years later, they're at the exact same point. Your bones at the exact same point. Well, your bone density just got better because the score of your bone density is along the line of this decline. So if you don't change, that's an improvement.
That makes sense.
On the other hand, if you drop off at the exact same rate, that's just steadiness. If you drop off faster, you're getting worse. But you get worse when you drop off faster than expected. If you don't drop off, you're improving. Or if you drop off more slowly than expected, that's also improving. And if you hold steady, now if you go up even a little bit, that's a huge improvement over the curve. So yeah, so there's T scores and Z scores, and your bone density is defined most typically by your T score, which is age matched. So if you stay the same, your T score gets better.
Okay. All right. And so you feel I can go back to de-prescribing, and I was actually making progress.
Yep.
Okay. And you said it can take up to 6 months for everything to kind of settle out?
In terms of blood levels, yeah.
Okay. All right. Wonderful. Thank you. I was hoping I could do it. Thank you.
You're making headway. Bye-bye. We'll see you.
Because of you.
Thank you. All right. Let me reset this. Okay. So next I see up with hands would be Karen. And I'm going to slide this from. Yep. Karen, you are up. Okay. Asked to unmute. And Karen, you're up.
Thank you. I had a couple of questions. The first one was about your thyroid reset diet book. Mm-hmm. So I read in there, you say to avoid all commercially baked products, but goods that are baked at home will be safe to eat.
Totally different. Yeah.
And then, but under the red light grains, one item listed is baking mixes. So I wasn't clear about that.
Yeah. So I guess baking things at home versus a premix, right? So like a cake mix or a muffin mix or something, there's a distinction there. And the mixes can use ingredients beyond what's listed. And that surprised me, but there was assays on things that were made from mixes versus things that were made. Most baking mixes ostensibly are flour, salt, baking soda, baking powder, pretty much just those things. But there have actually been assays on muffins made from baking mixes versus what those ingredients should have. And they're not the same for their iodine content. So that's a subtle distinction, but it's a valid distinction. I went through hundreds and hundreds of assays of iodine in different products. And I wanted to find like a couple of simple things. It would just look for this, just look for that. But it defied so much logic. And that was one example of that. The case in point, early along, I thought that I could say, yeah, go buy bread, but don't buy bread that has iodized dough conditioners. Some say that on the label and some don't. Well, there was a study. They bought a lot of breads that had that on the label and some that didn't, and they assayed them all for their iodine. And it was not predictive. There was just as many that didn't say iodized dough conditioners that had a ton of iodine as there was vice versa. So yeah, that's a distinction. Processed foods, they can trick you.
Okay, so baking at home, then bake from scratch. Don't buy a box mix.
Yep.
Okay, great. And then the second question, when I was first diagnosed about 5 years ago, all my scores were in what you were listing as your suboptimal range. Mm-hmm. But I had high antibodies.
Sure.
So I was automatically put on medication and said, okay, you need to be on thyroid medication because your antibodies are high. But from what I'm hearing you say, that's not necessarily the case. That is often said. People are often given medication for that reason, but there's been so many papers, just no evidence that medications help with the autoimmunity. And yet the autoimmunity can cause symptoms. So legitimately, it could have been affecting you. It could have been making you not feel well, but the medications wouldn't have solved that side of it. Okay. So then I might perhaps be a candidate to de-prescribe if that was my... Okay.
Yes. Now, a few more factors. So back to the de-prescribing. So one big question is, did you need them in the first place? Was your thyroid taken out? Was it ablated? Barring that, was it severely hypo? Was it with the T4 completely almost non-measurable? So in those cases, it might have been needed. You might need it longer term. If it's not those cases, then we think about how much medicine is someone on. There are those who are given massive doses that are far too high. They're on that for many, many years. In those cases, their thyroid can shrink up. And there's also a small subset of people that have a thing called Ord's disease. That's where their thyroid shrivels up to almost nothing. Barring those couple scenarios, most people are candidates to take less or none. So yes.
Okay. Thank you so much.
You're welcome. Okay. Remute. And I'm going to lower your hand, Karen. And now we've got Carla up. And Carla just joined us on video, I think, which is totally cool. How you doing, Carla?
I did. I'm fine. How are you?
Doing great. Good to see you tonight.
Nice to meet you. This is the first time I've attended one of your webinars.
Oh, awesome. Welcome.
Thank you. I wasn't sure how to do this, so I wrote out my question. So I just thought I'd read it to you. It kind of give you an idea.
That in the chat there.
Some background. Yeah, it's in the chat.
Okay, yeah, go for it. We'll talk through it.
Okay. So what I had written to you with my question was, hello, I was diagnosed Hashimoto's in 2011. I have been subclinical with varying levels, and I'm currently with a higher TSH and a low normal T3 and T4. So I'm still in that subclinical type of.
How high for your TSH?
The last time I TSH, it was like 7 something, 6 or 7.
Just very briefly, there's some guidelines that look at it differently when the TSH is way over 20. Sometimes they'll say maybe it's not subclinical, even if the free hormones are still normal. And that's kind of rare, but there's some views of that, but you're still clearly in what's called subclinical. So I'm sorry, please proceed.
No, you're okay. I think at one time it was told to me that if it was under 10, not to get too.
And that's a guideline you hear too. Some say 10, some say 20. Most now say even if it's higher than 20 and the free T3 are normal, they still call it subclinical.
Okay, good. That's good to know. So that changes too. Okay. I consistently have high antibodies, and the labs have currently the lab that my doctor sends my blood work through, it just says greater than 600. At one time, they used to give me a number, and at that time it was 1500. I'm not currently on thyroid medication. I was on T4 for a while, and prior to that, I was on Nature-Throid. And we had switched that at that time. There was problems getting it through my pharmacy. So where I'm at now is I'm not being medicated. So I'm kind of off of the medication route, trying to manage some of the other symptoms that go along with the autoimmune part of it. And my recent history is this. I had GI mapping done in 2018, and I have a functional doctor who we were working on gut. And I did have some mild imbalance issues. I think I can never pronounce it right. It's called dysbiosis.
Sure. Yeah, you did perfect.
So recently I've been on antibiotics 3 times in the last year. So I had some UTIs and a dental infection with my tooth. So now I knew I had imbalance issues before, but now I've thrown an antibiotic at my system 3 times in the last year. So they're worse right now, my digestive issues, and I'd like to start a probiotic to get things rebalanced there. My first question is there any strains, or there's so many probiotics out there, I don't know if there's anything I should look for specifically that would help me being a hypothyroid person. I was already messed up before, and now it's probably even more messed up from the antibiotics. I just don't know where to start to go out there and look. There's just so many different things, and I don't understand always the strains. They're long words, but I didn't know if you had any input on that on the gut side.
Sure. So general purpose probiotic, good documentation for harmful effects after antibiotics. Most data by far. Now, where'd my darn chat go? My chat disappeared on me again. I'm feeling like a Zoom idiot tonight here, you guys. I apologize. Somewhere or another, I had a chat window, and so I got the little chat icon. I'm clicking on it, and
I'm the same way with Zoom. I always lose the buttons, and I'm like, where am I?
I actually it's way over here. Got it. Okay. I see it now. I have this screen goofy. I'm dropping this in there. Saccharomyces boulardii, most data as far as general purposes, post-antibiotic effects, offsetting the negatives from antibiotics, by far the most data on that. Now, the other question though is that, will that help your thyroid? Now, a real popular thing in functional medicine is that you've got to fix your gut to fix your thyroid. The gut causes autoimmunity, yada, 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 yada. Now, there is a lot of data showing that changes in the gut correlate with changes in autoimmunity. And you could logically think that if one goes with the other, that if you change this one, it'll change that one. But there's no data saying that. There's actually a lot of data saying that it doesn't. That if anything, the gut changes might not be causes, they might be effects. We've got a lot to learn. So I have nothing against having a healthy gut. Believe me, I'm all for it.
I understand that, but I might not see benefit where I think I would, because there might not affect each other, is what you're saying.
Correct. So have a healthy gut. Don't expect it to lower your thyroid antibodies.
Okay. Good to know. Okay. So, other question, thyroid, I think related too, and it's kind of in with the gut, but do you see that there's a lot of relation between stomach acid production for folks who are the hypothyroid? I've been down that route, and after these antibiotics, my stomach acid is going haywire too. And I don't know if it's because of the antibiotic after effect or if it's just my thyroid flaring up again, but it's not quite right these days either.
Sure. So just two thoughts. One thing I was about to put up anyway. So benefiting the antibodies, single thing I made for that purpose was antibody support. I just dropped that in the chat.
Oh, now, good. Thank you.
Stomach acid in thyroid disease, there's about a 30 to 40% overlap between those who have autoimmune thyroid disease, like you clearly do with your antibodies, and a thing called atrophic gastritis. So a lot of folks have autoimmunity that goofs up their production of acid, and over time it can damage that and harm that. I'll get a link of a detailed article that talks about that. There's not an easy answer, an easy fix. It's more a matter of just screening for that and then not doing things to make it worse. But yeah, strong overlap.
Okay. Thank you so very much. I appreciate it.
You're welcome. Thanks for being with us tonight.
Thank you.
Okay, so I'm getting it's also called even thyrogastric syndrome because there's such a strong connection between it and thyroid disease. But no joke, like 30 to 40% overlap. It's a really big deal. And the thing that makes me nuts is that the symptoms of it can hurt acid output, and it can cause these symptoms that look like symptoms of a lack of stomach acid, validly so. But then many think that we want to give acid as a solution. And that's like the worst thing in the world to do for those that have thyrogastric syndrome. So
it's a catch-22.
Catch-22.
It is a catch-22. And you, at least for me, it's sometimes it's hard to know where symptoms, it's hard to know what's responsible for what. Thyroid is governing this, or is it something else, in my body that, it's not related to thyroid. So that's where it gets confusing.
And that's a good point. And I'll mute you now, but I'll just respond to that a bit more. The symptoms, they're what matters. The important thing is your symptoms going away and you feeling better. And feeling better today, but also feeling better tomorrow and for decades. So feeling better in ways that are safe and stable and lasting. The drawback is that symptoms are, I think about like a warning light in your dashboard and then like GPS directions. So symptoms are not GPS directions. They don't say, scratch here. They just, something is off and it's true, but they themselves, one case in point. So too little and too much thyroid can feel exactly the same. And the symptoms matter, but the symptoms don't tell us what to change necessarily. And sometimes you're right, there can be many factors involved. And the best approach there is, just find all the factors that there are safe ways to treat and address and take care of them. And, let the symptoms come out in the wash. And after the fact, you may not know which ones were what, but if you're healthier and better, then that's okay. All right, Joanna, you're up next. And there you go. Let's hear what you got.
Hello.
Hey there.
Hi, thank you for taking my question. Great to be here. I was a patient of Dr. Espinal's for a few years.
Oh, cool.
Yeah. So my teenager and I are both have hypothyroidism. So I have a couple of questions there.
Sorry, just briefly, teenage girl, teenage boy?
Teenage girl.
Okay.
Yeah. So my question about her is, at one point her TSH was 3.66. Most recently, it was pretty close to the optimal range at 1.84, I want to say. But the interesting thing is she's always cold. It doesn't matter if it's winter, summer, anytime. And she's also experiencing some hair loss. So what I'm wondering is, would you say that a combination of thyroid daily plus the new hypothyroidism supplement might be a good way to, good experiment to run for her to potentially?
Those are good considerations. I think about her iron levels too. If if a woman's menstruating, it's actually safe to take iron without direct measurements, but you can always measure and find out to know if that's a culprit or not, and also to see if she's making some progress. But with those symptoms, and I'm assuming she's having just normal periods at her age, but that's a huge factor, that's for both of those symptoms especially.
Yeah, she's been on the iron chelate by Designs for Health for a while, but we haven't checked on it the past few months, so I can definitely look into that. Thank you.
That's a great one. The one I made now, I actually like even better. So the difference about it is that there's more iron per pill. It's a kind of iron that's better absorbed, and it's got a few things that make it work more effectively, that make it have fewer side effects and be better tolerated. I'll put a link up for that right now for you.
Thank you. I appreciate it. And my other question is, I'm curious about de-prescribing. I've been on 60 mgs of Armour for a couple of years. Before that, I was on, oh my gosh, I'm blanking out on the name. But the one that you and your people
probably
would
WP
always,
thyroid and or Nature Thyroid or
Nature Thyroid. I think it was Nature Thyroid until the recall happened, and then we switched.
Yeah.
At any rate, so I'm feeling well as far as energy level and all that. I'm still hoping to lose a fair bit of weight. And so what I wonder is, of course, under doctor supervision, but I'm curious about best practices for de-prescribing, and also if I were to try the hypothyroidism supplement, would you recommend that I take that for a while before de-prescribing, or could I start both processes around the same time?
Start both around the same time, totally fine to do. It is indicated to help de-prescribing become more successful. That's totally a correct use for it. You said you're taking how much of NP thyroid right now?
60 mgs.
60 milligrams. Okay. So most of the studies were done on a 8-week protocol, believe it or not. So pretty quick. Joanne talked about doing it more slowly. That's fine. Some do that. And again, just knowing that if someone had a severe version of hypothyroidism, the thyroid is shrunken up, whatever. But typical scenarios were 8-week timeframes and 25% reduction every other week. And you're right, that's under medical guidance. But so a popular approach, who also might be relevant for anyone else, is to have a lot of low potency pills on hand. Like when you're on NP, they make a 15 milligram pill. So a lot of folks, when they de-prescribe, they'll talk to their doctor and they'll get a large batch of 15 milligram pills. So right now you're basically taking 4 of those, the same thing as 4 of those. So if you had 15s, you can go from 4 to 3 to 2 to 1. And you got, one big bottle of pills that can work for all those different steps. It's a whole lot easier than having many different potencies and all these trips to the pharmacy. So that's one practical thought for that. But at a 25% reduction, that's just a 15 milligram reduction for over 2 weeks. During the process, there's emerging symptoms and there's progressive symptoms. So it's not uncommon, even if somebody never needed thyroid medication, when you take it, you make room for it. So if your thyroid, to make up some math, if your thyroid was going to make about 100 micrograms of hormone per day, and you put someone on 50, they're going to make about 50 less, right? They're going to make room for that. The body doesn't want too much. So if you suddenly went to like that 50 to 0, well, it's going to take them time to go from 50 back to 100. So whenever you make room, even if the body never needed it, it's a little bit of time to like unpack and make what it was making before. So it's not uncommon to have some symptoms show up. They generally don't last. If symptoms are extreme and they're progressive, they're worsening and worsening, that's a sign for someone to pause and stay there, maybe not go further, or maybe just give it more time, take it more slowly. Those are both options. But given the right circumstances, many can do well.
And what symptoms would I be keeping an eye out for?
It's really a matter of the ones that someone might have had before when they were changing a dose or when they first went on treatment. So that's most typical.
So whatever was happening before may return. It's not typically no symptoms.
Correct. Exactly.
Awesome. Thank you so much. I appreciate it.
You're welcome. Good to see you tonight.
Good to see you too.
Okay. I've got this wide window open and part of it's tucked away behind the corner. So I wasn't seeing things. So I feel silly. But Nancy, you are up. Go for it.
Okay, I have just a couple random questions.
Let's see how random you can get here with me.
All right. I live in northern Iowa, and
Okay.
I was wondering if we went fishing in the lakes in Iowa and Minnesota, South Dakota. Are the fish like the walleye and pike and stuff like that, are they low in iodine?
Freshwater fish are low in iodine.
Okay. And the other question I have is I like to use the So Delicious coconut yogurt, the plain, but it has 9 grams of sugar in it. Is that a problem?
Well, problem in terms of like overall health, problem in terms of iodine. In the big scheme of things, sugar is something to where if someone has all their day's food already, they got their full caloric requirements, and you go and add on like an extra 100 grams of sugar, it'll wreck their health. Now, if somebody, on the other hand, has a diet to where, including that 9 grams, they're breaking even, they're getting what they need, they've got a lot of nutrients otherwise, probably not a big deal. A healthy diet has somewhere between 5 or 10% of calories that could come from whatever, in all honesty, and not be a big thing. But there's no direct effects as far as the iodine content. Thankfully, a lot of those products used to have carrageenan, but that largely went by the wayside. Vonnie Harry, Food Babe, good gal, she's a friend. She did a lot of good work to really get people to protest carrageenan and pull it off the market, and it's largely gone. So, yeah, I wouldn't worry about that.
Okay, that's all.
All right, good luck fishing.
Thank you.
Okay, let's lower Nancy's hand here. There we go. And David. Nice to see you back. How you doing?
Mute. Okay. Hey, good.
You got it.
So I was just a quick question. I got an email from you a while ago. It was about Detox IV, and I was curious about that. I don't understand the science of it completely, but I've heard bad things that I don't know how to evaluate. The criticism of it is some people say, oh, it's dangerous, it'll put metals into your brain and so on. Are you very confident that this is it's definitely a good thing in general to do? What are your thoughts about the criticisms of, I think it's EDTA?
Yeah, great question. So EDTA, DMPS, DMSA, these are the compounds that are talked about. And the criticisms are fair in some contexts. So some of the negatives are that these things are used in doses that are not always appropriate. And I've seen examples of people who were given amounts and frequencies of chelation that were simply not needed. And there's a point at where that can cause harm to the kidneys, that can take away some good minerals from the body. So those are valid concerns. Now, another negative I'd like to put out is that these are used so to back up in a step, these can be done to clear the body or also for testing purposes. So kind of different reasons. And I think you get this, but to explain this, so the testing purposes, there's a lot of waste your body can hold on to that don't come out very easily. And so there's an idea of challenge testing or provocation testing. And the idea is you give someone stuff to make wastes come out, and you measure how much comes out. Now, the drawback is that everybody gets rid of some stuff. By getting rid of, we're talking about peeing here. So this is like urinary excretion. So anyone can take a high dose of a chelator and pee out some metals, like anyone on the planet will. And I will say that there are those who will give high doses. And, I always assume positive intent for people. So I assume they don't understand, but they see these high levels of toxins show up. They make a big deal and they keep on treating and treating and treating. And the way some labs report visually, like this green, yellow, red scale they make, what red is numerically after a challenge test is actually normal. It's like where most people turn up. So that's a drawback, is there are those who have said, no, this is done to defraud people. It's done unscrupulously. And again, I'm not implying bad intention, but I would agree that it's not accurate. So those are some negatives. Now, as far as the thing about metals in the brain, there has been an idea that when you chelate things, they will mobilize, they'll move in the body and settle elsewhere. Yeah. That idea, however, about going into the brain, there's different versions of chelators. Some create permanent bonds and some create temporary bonds. Mm-hmm. And the ones that we just mentioned are all ones that create permanent bonds. They're called binding moieties. And that's kind of what the word chelate means. It's the same word as like crab or crab shell. So they're bound in ways that are irreversible. and they can't really redistribute. They just can't. There are older generation chelating agents. One was called British anti-leucite. There's another one called penicillium, not penicillin, or penicillamine. I'm sorry, I said that wrong. But these are things that were around quite some time ago, and they did make semi-permanent bonds, and things could redistribute. But with third and fourth and fifth generation chelators, not a concern. So those are all valid criticisms. Now, the appropriate use is that I made that statement saying that this is a good time to see what might be in the body. So the idea was you can do a treatment that's also a test. And if you had small normal amounts come out, great, you're done. But there are wastes that by definition bind deep in the body's tissues and are not spontaneously found in the urine or in the stool. And the term is bioaccumulate. So once you get a lot in your body, they stay there. And not only that, but they inhibit other detox processes. So they make it to where other things that might come out more readily don't come out quite as readily. And we can best gauge those by these challenge tests. I don't want to, I'm getting passionate about this. I want to intentionally cut myself off or I'll go on too long. But for a long time, I've wanted to find great ways to measure the toxins in our bodies. And there's not perfect ways. There was a laboratory called AccuChem, which was around decades ago. And they had these panels. You could choose thousands of different types of volatile chemicals that you could measure. And a group of us, we did 36-hour fasts and blood draws. And the idea was after a long, long fast, you're breaking down fat, more will go in your bloodstream. And we compared 36-hour fasts against tissue biopsies. So we did fat biopsies. I got a scar still. So we did these biopsies and said, what's definitely there in our toxins, that in our fat that you can measure directly, versus what can we see in a more convenient, safe test that we have our patients do. We never our patients do biopsies. That was silly. So things showed up on biopsy that never showed up on the blood. So there's waste that get trapped that we can't see in blood tests or urine tests without challenging agents. And there's a lot of things we can't measure for that are there. So metals, the convenient thing about them is they're measurable, and we have ways to push them out and see how much is present. So it does take dosing with a sense of how much is appropriate for someone. It does take reading the labs with a sense of what's actually normal and what's really unusual and worrisome. And sometimes the lab report could mislead someone in that. So it takes more depth and nuance. And it takes understanding a global sense about, besides just that, what else with detoxification. So that was a very long answer for your question, but
okay. So basically, it's not going to go into my brain deposit there.
Not going to go into your brain.
All right.
Nope.
And so, will you post this video today on YouTube or anywhere so I can listen to it again? And
yes, we'll get a replay link up, and we'll get the email sent out. I just talked to my team. Should be by Tuesday or Wednesday, we'll get the replay out to you all.
Okay. So it is basically a good thing to do for people's thyroid health. Everyone maybe should do this once in a while. Cadmium
and mercury are the big ones relevant to thyroid health. Lead can be relevant as well. And if we see those things there, you know what's there. You can take it out. You can clear that. And it's a big deal. I grew up with poor dental care. I had a mouthful of amalgams. I went through mercury detox. It was life-changing for me. I felt my brain work better with each session. So it's real. I've seen this for tons of people.
Okay. Thank you very much.
You're welcome. Okay. Lower hand. There we go. Let's get a couple more still. Donna, let's get you. How you doing tonight?
Hi. Hello.
Hey there.
So I've got a couple of questions. First of all, I landed on you a couple months back through Isabella Wentz's book.
Oh, yeah.
And initially thought maybe I was like a Hashimoto's person that was undiagnosed, because I can't quite get a good answer from a doctor, but my antibodies lab comes back as 1. So I don't know if that means I don't really know what that means, but anyways, so I started down the road of the iodine detox. And
I'm sorry, were your thyroid levels off in some way, or some symptoms or anything, or just antibodies at 1, or what all was driving that?
So my I don't want to make a really long story, but since for about 10 years, I've checked all the boxes on all of the thyroid or hypothyroidism symptoms,
Okay.
But it also kind of corresponds with menopause and having a hysterectomy. And so my hormones have always been like gone. And so just trying to balance, I worked with the functional med guy, and at first he's like, well, it's good you don't have Hashimoto, so we're going to treat you with a accelerated iodine. And he had me on, yeah, I know, like 3 pills. It was ridiculous. Oh. Anyways, so that whole road, and none of that worked. And anyways, coming back around to, originally I got, mostly it was upset about the hot flashes, the brain fog, and the weight gain. And the hot flashes and the brain fog have gone down quite a bit, but the weight gain has really increased over the last year. So I'm like looking at the iodine reset diet at first, but I'm like, but I've always been told that my iodine labs in the last couple of years have been too low almost. My iodine levels have been at like 39.
Sure.
And looking at all the things you said, I'm like, I don't have the iodine exposure. So is it possible to then, if I go eliminate all the more iodine stuff, is it going to be at a possibly too low of a level?
So let's dive on that one real quick. So there's separate things. There's, why are these symptoms happening? And there's, what do your iodine levels mean? Let's pull those apart. So your iodine levels, these were blood tests, the numbers you're describing, I'm guessing, or?
Yeah.
Yeah. So iodine blood tests, they do correlate with iodine toxicology. If you had so much iodine come in your body that your kidneys couldn't clear it, eventually your blood levels would change. Before that happens, however, your blood levels of iodine have no relationship with the iodine in your body or your thyroid. They have no diagnostic value whatsoever, unfortunately. Okay. And that's also true of urinary iodine tests. So the deeper question, though, is this something you need to pursue? Is your thyroid off? If your antibodies are 1, so low levels, very low positive levels of thyroid antibodies can be perfectly normal. It's actually how your body can get rid of old dead thyroid cells. It's like a normal way of just cleanup. Okay. When they're high and we're seeing relevant symptoms and changes, that's all different. But we wouldn't say there's a thyroid problem just because there's a speck of antibodies present.
Okay. So basically, my blood tests have never come back out of range, right? They're always within range. So TSH is always fine. For a while, my free T3 was off a little bit, but the functional guy, again, was trying to fix that.
I wouldn't put weight in that one. Yeah, that's when it's not worrisome.
The other one that has always been low is my DHEA.
Mm-hmm.
Anyway, so what my question is, so we're not going to worry about the iodine. I just kept going on the low iodine thing. But in the process of reading that book, I have then switched to your metabolism reset, because I'm like, yes, I'm totally stalled. I'm all these symptoms. Basically, you described me to a T. So I did the 28-day reset, which was one of the hardest things I've done in my life. I've got to say.
Kudos for you for getting through it.
Yeah. And I mean, like the first week I lost 6 pounds, and then it was like half a pound, and it was just like slow. It was fast on my waist until it was just really, really slow. But the other question with regard to that,
had some waist loss, you said, it sounds like
3 inches.
That's awesome. It's a huge change to your health. That's great.
Okay. And so now
I'm sorry. I've got to just like one more quick lap here. So 3 inches and 6 pounds, maybe it's a few more pounds, but that means you didn't lose muscle mass. So the more inches you lose on the fewer pounds, the better that is for your long-term health. That means you're not going to regain. Most women on typical diets only lose 1 inch per 12 pounds of body weight, and they're mostly losing muscle because of that. So when you see a bunch of inches and only a few pounds, that's the biggest win possible. So I'm sorry, go ahead.
Well, but then going into the maintenance phase, just being really like just really afraid. Like, I don't want to go back to, just, almost to the point where you're fighting like shame when you're eating. So just trying to work through some of that. But one of the things that I did notice during that 28 days is my morning glucose was always like 90.
Mm-hmm.
Even doing your 2 shakes a day and totally following suit for what I needed, filling all the 4 categories for my dinner. And is that something I need to be concerned about? No, because everything my husband's like, 90 is too high in the morning. You shouldn't be that high. You're going to be, type 2 diabetes down the road. And
no, that's quite normal. That's not worrisome.
It's just because being on like no sugar, no dairy, all of those things that I would think would be there to raise it were eliminated.
So you're also clearing out stores from your liver. So your morning sugar, let's think this through. Your morning blood sugar, have you eaten in the last few hours? No. Yeah. You didn't just have sugar, right? So what's happening with your morning blood sugar, it has nothing to do with your recent meals. It's what your liver is releasing. So it's not uncommon to see it even higher during that because you're getting rid of stored glycogen and stored triglyceride. But even diabetics, their morning fasting glucose, even their midday glucose postprandial, most of that is not from the meal. It's what the body is dumping out. So these are not really problems of, it seems like this isn't a bucket of sugar, but it's like a bucket of sugar and you pour that in. Oh, that's high blood sugar. That's not how it works. No, that's not how high blood sugar works. It's your body releasing too much in the bloodstream. It's not what you just poured in from the last meal. Now, high sugar meals aren't good for you for a lot of reasons, but high blood sugar doesn't mean you consume sugar.
Okay. Yeah. No good.
So yeah, you've done great. You're doing the right things. Keep up with the metabolism reset. Look at the maintenance guidelines, and the new book could be a good fit. There's actually a lot of recipes I made that are targeting more menopausal symptoms as well. So yeah, that's coming out in June. Someone asked me to mention that. So this is going to be the healing hormone cookbook. I should have that name down better. But the big 5 hormonal symptoms of weight, fatigue, brain fog, insomnia, and hot flashes, and how do you use phytonutrients? How do you use things in plants, just safe, natural, simple foods to combat those symptoms? So one way to use the new one is you can choose recipes for those symptoms. The other way to use it is, here's a lot of great recipes you can use for any of the resets. So you can use it for adrenal, thyroid, metabolism. You can use it for all of the others. There's more options. Or you can target a symptom. You can say, I want to really drill down on these hot flashes. Here's some recipes to help you with that. And here's some good science why. So yeah, that's coming out in June.
Okay, thank you.
You're welcome. All right. So I've just got a few more up and I'm kind of past my target time, but I want to see if I can't get to more of these. So there's no name on this one. It says iPhone. So I asked to unmute and there we go. I just saw you unmute. Go for it.
Hello.
Hi there. What's your name?
Hi, Doctor. Praveen.
Praveen.
Not type in? Sorry, I never joined website. But thank you so much. This is first time I'm joining Zoom call, so I'm kind of a little bit nervous, but I'm
you're doing
be able
fine.
to. Okay.
We'll sort it out.
So I want to show you my book.
I've seen that one before.
This is really like, yeah, amazing. I love it. So now, doctor, my question is, I just visited my family doctor with my thyroid lab results and show her your book. And she definitely said, okay, on this book. And she said, yeah, follow the diet. That might be a good step forward. Just getting rid of this thyroid disease. So now my numbers are a little bit kind of alarming. Usually my TSH is high, but this time my TSH is 0.2, which is below average. Yes. And then T4 is 0.9 and T3 is 91. And the last time, like 6 months ago, I had a TSH 5.8. And
I'm sorry, you're not on any kind of treatment right now, I'm assuming.
No, actually, I am taking supplements for that. That is from biotech's research because I used to have a nutritionist. She was helping me, naturopath. And then I just stopped taking service from her because I thought maybe I can maintain my good lifestyle and having this and I should be okay. So that is a GTA 42 from biotech research. And then now I found your book and I feel that I'm confident enough that I can handle my situation. So now I don't know if you are aware of this GTA 42 from biotech research that is for hypothyroid. Okay. And it has, which is like a gland, basically live, So I'm a little bit kind of, go ahead.
I think I know my answer already, if you don't mind.
No, I'm not.
Yeah. So there's natural desiccated thyroid medication. And some people have talked about that. Like there's Armour thyroid, there's NP thyroid, and that has pig. It's called porcine pig thyroid that's in that. And there's also over-the-counter products that have bovine or cow-derived thyroid. And cow thyroid does contain thyroid hormones. And there have been several times in which scientists have bought products just like the one you have, and they've brought them to laboratories and they've assayed those to see how much thyroid hormone is in those products. And sometimes they have a lot more than you would find in medication, believe it or not. And the amount they have varies tremendously from pill to pill. So what your scores show is that you're getting a very high dose of thyroid medication. Now, the drawback about those kinds of products is that they're not standardized, they're not regulated, you don't know really how much you're getting. But there's also a problem of contamination in cow thyroid with things called prions. Prions cause a thing called Creutzfeldt-Jakob syndrome, which causes irreversible brain damage for some people. It's also called mad cow disease when it shows up in cows. And there's a lot of talk about pulling all these products off the market. It may happen soon. They're frankly not safe, but they have active thyroid hormone. And your scores show that either there's a lot of active hormone in that, or you're now in a hyperthyroid state. But all thyroid experts strongly recommend against these over-the-counter bovine thyroid products for many reasons.
That's exactly what my doctor told me today. She said, stop taking this now, just to follow the diet you see in this book, and just, lifestyle change. And 2 months later, she wants me to do this repeat labs. And if I stop taking this one, and during my going forward time, so would you recommend any kind of natural thyroid supplements for me? I don't want to take allopathy medicine. Sure. I would rather have something which you can,
Sure. So I'll make a link. The new product that I mentioned tonight, the Hypothyroid Support, that's a great fit. And then the baseline is the Daily Reset Bundle. And these are free of all active hormones and no bovine glandulars in them. I do avoid those completely. And that's all fine. That's appropriate. But you're doing the right things. I just put that in chat there.
Is it appropriate to stop taking this? Is it right time to stop taking this?
I agree with your doctor. Okay. Yeah, I agree with your doctor.
And I'm going to take this lab. Then afterwards, I will start taking supplements you recommend.
That would be the best step.
The results. Yeah. All right. Well, sounds good. And another thing I want to say, can I continue to take my zinc?
You can. So zinc is a useful thing to have. It's already in those ones I recommended for you. And I wouldn't recommend extra on top of that. With vitamins, more is not better.
Okay. Sounds good, doctor. Thank you so much. I truly appreciate this book because I'm by nature vegetarian vegan, but it has not disappointed me so far that you have to eat meat or something. There is
you don't have to do that at all. All right. Thanks for being here.
Thank you so much for your time. Thank you. And sorry for the mess up start, but I'm comfortable now.
You're doing fine.
Thank you. Thank you, doctor. Bye.
Okay, so quick check-in, you guys. I think Zoom is going to kick us off in a few minutes. I'm going to keep on just talking anyway, so I'll take a few more questions the best I can. Just so you all know, I'm doing consults these days as well. So a lot of detailed questions come up, and I can help with these sorts of things in person. And I'm going to put that link up just so you all have that. These are just you and me one-on-one. We talk through things in great detail. I give you a plan. You can work with your doctor about that. I can communicate with them. So there's a link to where that can be made possible. And again, I'm going to grab a few more and keep on talking, but we may get cut off in a few minutes. If so, that's why. So Julie, you're up. I'm going to ask to unmute and let's hear what you've got. We'll go as far as we can here tonight.
Hi. I just have a quick question. Is there a target number that you look for in the reverse T3 value?
Yeah, that's a great question. The short answer is it's not something I really encourage screening or testing for. I don't feel it's a necessary thing to test. And I'm going to give you a detailed link that explains all that in crazy details. When it's high, it's most commonly high because someone is on an excessive dose of thyroid medication. And we see that through other parts of the test panel as well. So there's no harm to testing it, but there's nothing it tells us that you don't see from the rest of the tests that are already there. There's an argument out there. A gentleman named Dr. Dennis Wilson created this argument saying that many people make too much reverse T3 and reverse T3 then blocks the body from using T3. And it's just not true. Reverse T3 is not a bad guy. There's many bad situations that correlate with high levels of reverse T3, but reverse T3 doesn't cause the bad situations. In fact, most of our T4 that we make is made into reverse T3, and our brain needs some reverse T3, and it doesn't block T3 at all. But if someone takes far too much thyroid, their body will dump a lot of that into reverse T3 as a safety mechanism. And if someone stops taking all their medicine that has T4 and only takes pure T3, they can lower their reverse T3, but they're not healthier by doing so. So that's a quick once over, but I just put a link up where you can go very deep into the reverse T3 discussion if you wish.
So, okay, so the practitioner that I have been working with always says that instead of just the typical labs, the TSH, the T4 free, and the T3 free, should always add the reverse T3, but you don't agree with that, is what I
don't find it helpful. No. And tests all cost money. I just don't test for it because I don't find it helpful. If someone has high reverse T3 and they're on too much thyroid medication, they also have a low TSH. So you already know that.
Okay. And just to add to what you mentioned in the last discussion or last question about the desiccated thyroid, and the over-the-counter, because years ago I was on the NatureThyroid, then I did some Armor, and actually now I'm taking something from Allergy Research Group, a glandular, that's bovine. So you're saying not good.
No, I can't express that enough. There was an assay done a few years ago, and they bought a bunch of these products and they measured them, and they had extremely erratic and also exorbitant amounts of hormone in them. They claim that they claim on some labels that they have no hormone. They've removed the hormone. There's no way scientists know how you can do that. It's not possible. So they do have it, but the amounts are completely different from pill to pill. And in fact, many products have synthetic hormone added on top of what's there. Then the other concern I mentioned is the prions. So this is cow brain tissue. So cow brain tissue ends up in cow neck tissue, and cow brains are not safe for human consumption, but they are put in these pills because they're not regulated.
Okay. So do you think that Armor is safe?
Armor is pig tissue. So completely different in that sense.
Okay. So you feel,
and it's also, it's a product that's standardized. So they have to assay how much hormone is in that, and they make it based upon that. But it's completely different idea.
Okay. So that one's considered safe to use as an alternative.
Right.
Okay.
When it's needed. The bigger question is if it's needed or not.
If it's needed, yeah. Okay. Thank you.
You're welcome. Let's grab one or two more if we can. I'm going to remute real quick. I just see two more up. I gotta clean my plate here. I gotta help everybody best I can. Tina, how you doing?
I have one itty bitty more question. The reset diet, the reset shake, the vanilla has sugar in it. Would it aggravate candida or oral thrush?
I'm glad you asked that. So sugar, remember I mentioned about how the word steroid means a lot of things, like people means a lot of things, sugar means a lot of things. Sugar means purified, refined cane juice for one context, but sugar also means black beans contain sugar. Wood has sugar in it. Meat has sugar in a broader chemical sense. So sugar to a chemist, yes, but the sugar in there, it makes me nuts that it's on the label like that. It's apple pectin. There's no bioavailable sugar. There's nothing that feeds candida. There's nothing that makes your blood sugar go high. It's apple pectin is all that it is. So there's no concentrated refined sugar in there. So no worries at all that way.
Thank you so much.
Happy to help. Easy one.
That is a relief.
All right, let's get Kim. And I think that's going to cover the ones we've got up. Just so you guys know too, I will look through the chat, and if there were ones we didn't cover in the chat, I'll still see if I can't address those in some way. But otherwise, we've got the ones from hands that were raised. Almost. Maybe we'll get one more. We'll see. Kim, go ahead.
Kim, I was looking to see after the maintenance, are you still dairy-free and fruit-free?
Now, Kim, you're talking metabolism reset, thyroid reset, or?
Metabolism reset.
Okay, metabolism reset. I didn't really exclude dairy. I talked about just a few dairy options in terms of their protein content. So those weren't avoided. Now, if you are watching your thyroid, they can have iodine, so that's different. The fruit is not excluded during maintenance, though, no. I do give some ideas about where fruit can sit in a healthy diet. A silly example is that you wouldn't want, a quart bowl of raisins 3 times daily for your diet. So there's some silly things like that. But yeah, fruit in variety has a lot of places to belong in maintenance. During the reset, it's kind of weird, but there's this balancing act between fructose and glucose. And part of the reset process is changing the proportions of those two. And that's why I left fruit out during the reset phase. But during maintenance, there's tons of health benefits to fruit.
Okay. And when is that then integrated?
So the maintenance starts at the end of the 28-day cycle.
Okay. And dairy?
So dairy, if you're not managing thyroid concerns, you're not watching iodine. And actually, if you are, it still fits as a yellow light food. So those on the thyroid reset diet, on maintenance, you can add in 1 or 2 yellow light foods per day on maintenance. In the metabolism reset, in terms of the maintenance ideas there, I talk about some of the healthier versions of dairy that have no added processing, yogurts, cottage cheese as good options for protein for those who aren't watching their iodine overall.
Okay. That was it.
All right. Glad to help. Okay. One more. I'll stop after this next one, wherever we're at, because I gotta wind down. It's getting late in the night for me, believe it or not. Robin, you are up. So go ahead.
Hi, Dr.C. Oh my gosh, I thought I had my hand. Can you hear me?
I sure can. How you doing?
Okay. I had my hand up all this time and I didn't. So
you timed it perfectly.
I'm calling in from Germany. So
your audio's a little low. It's kind of coming and going.
I'll just get closer to my computer.
I think that helps. We'll be close here.
All right. I'm calling in from Germany. I've been following you for quite a few years, and about 2 years or a year and a half ago or something, when you first came out with your antibody support supplement, I started taking that, and I had wildly good results with it. So I guess something in there was one of my triggers for my autoimmunity. My antibodies used to be as high as 600 and they went down to like 180. But right about the time they got to 180, I started having heart palpitations. Now, later in this progress, I realized that I had accidentally gotten a fairly considerable iodine exposure around that time as well, because there was some hidden iodine in an electrolyte supplement I was taking.
Oh, that makes me nuts. A lot of them have a ton of iodine, and I can't figure out why you'd put it in there, but they have it
in there. Yeah. And I took that for months and didn't know it. And despite taking iodine for months, and I'm like a cyclist and stuff, and I would get thirsty.
Oh, you can go through a bunch of that.
Yeah. So I started getting heart palpitations sometime around then. And I have a naturopath and a nurse practitioner that work with me on my hormones and my thyroid. And they were both, they didn't know what could be causing that. And I hadn't identified the iodine exposure at that point. But I ended up just starting to have to notch my thyroid dose back, because if I stayed on my regular thyroid dose, I was feeling like hypothyroid.
Robin, I don't doubt the iodine was counterproductive. The other thing that happens, though, is that with the things you were taking, the antibody support, it's really common that and also just avoiding iodine in general, it's really common that you outgrow your thyroid medication, that you need a lower dose. So that could have been part of the palpitations as well.
Okay. Yeah. That, and my naturopath at one point hypothesized, the other thing that could have been going on is that I went off of I started eating my dietary triggers because I was traveling a lot and it was too hard not to skip my I was eating gluten, dairy, and egg whites with impunity. And she hypothesized maybe my autoimmunity and my antibodies shot up to like they're at 300 now. Okay. She's wondering if my autoimmunity is triggering, as it's chewing away at my thyroid gland, is it spewing out thyroid hormone in bursts? But the thing that's weird about these heart palpitations, which have continued all off and on for all this time, as soon as I try to, my labs show that I'm not getting enough thyroid hormone, and my doctors.
So? Do you know?
Right now my TSH is at 12. Okay. And it used to be in the very low normal range all the time on my normal dose, but I feel like I'm hypothyroid a lot of times. Like,
Sure. Well, 12 would be consistent with hypothyroidism.
Okay. Well, where is the hypothyroid coming from, and how do we figure out, is it from, I'm now taking 15 milligrams of Armour Thyroid, where I was when I started this journey with your supplement. I think I was taking 90.
That's great.
So, but I've been on medication for 10 years, and I have quite a bit of damage to my thyroid, according to an endocrinologist that scans me every year or two.
So if your T3 and T4 have not tanked, then you would be subclinical. And that means your gland is being yelled at, but it is still working. And the 15 milligrams you're taking represents about a sixth of the typical adult's thyroid requirements. So you're making somewhere around, 80 some odd % of your body's needs. So it's not quit. And you've done a lot of things that have made a big difference. You can dive on those quite thoroughly and see if it can't improve from that.
I'm looking at my lab results here, and it looks like my T3 is now low.
Low below range, huh? Low normal or below range?
It's right below the range. The range is 76. My T4 right now is normal.
Okay. So your body is not lacking. So what happens is the T4 drops off first when there's a lack. Believe it or not, your body adjusts the T3 on purpose for a large range of reasons. One can be to spare the effort on your thyroid when it's struggling. So that's not a deficit at this point. But yeah, you've got the option. You've got the option of taking more medicine. You've also got the option of going harder on the things you've done before and seeing if that improves it. But you're doing a lot by yourself.
All right. So if I continue to have heart palpitations, I can continue to lower my dose and not have to worry about.
The heart palpitations do certainly confirm that there's not other causes behind them. They can be completely unrelated. Paradoxically, they can come from. Yeah, they can come from unnecessary thyroid medication, independent of your blood levels. They can come from too much. They can come from too little. But yeah, barring other cardiovascular concerns, do the right steps for the thyroid.
And the other thing is, where does adrenal dysfunction fit into the de-prescribing? Like, I seem to only get heart palpitations when I get like a massive cortisol rush about 2 hours too early in the morning now. And then my heart either palpates or sometimes it just pumps hard. But
just a general thought that's totally relevant to your health, to de-prescribing. You want a good cortisol rhythm. When we're seeing those symptoms at the night, there's often blood sugar drops occurring in the late evening. And what happens is your body makes cortisol to elevate glucose. And that can often cause a variety of symptoms later at night. So managing blood sugar, RS complete, tracking your cortisol cycles, all the adrenal reset diet ideas, those are appropriate, but you've got a lot of the right tools.
Would dropping my dose kind of precipitate a cortisol thing sometimes going wonky on me? Because I'm pretty good about, like, I normally, if I think I might get low blood sugar at night, I'll eat a couple nuts before I go to bed.
And try resistant starch. So, you want things that give glucose, because that's the part that your body requires. So things that give glucose that are in a slow burning form, and then investigate your adrenals and keep them healthy for sure. They're certainly part of your symptoms.
All right. So it doesn't sound like I need to worry about the heart palpitations as, could that iodine still be having trouble getting excreted from, I think the last time I took that electrolyte was, I don't know, last November.
Rarely, very high doses, what you're talking about is usually milligram doses. Sometimes like very high doses, like 25, 50, hundreds of milligrams can take 6 months or more. But in most cases, the doses you're describing rarely take more than a few months.
All right. Well, then I'm going to chalk it up to an adrenal thing. And also maybe that I can continue to try to lower my medication. But now on 15, I'm feeling, that's the thing. I feel great during the day. And it's just
so
that
symptoms that change day and night are less thyroid symptoms and more adrenal symptoms. That's the circadian symptoms are more adrenal.
Okay. All right. Thank you so much. And thank you for creating these supplements. I can't tell you how much better I felt when I got my antibodies down so quickly.
What's the trick for Germany? How do you go about shipping there?
I don't.
Normally in the US
I order 6 months supply when I'm back in the States, and then I have to pack it all in my carry-on bag. But I ran out because they work so well, and I was continuing to take them. And now I'm having to have my mom kind of slip it one bottle in at a time and send me just goofy crap that she, like a dirty towel, throw it in the mail with a bottle of your supplements in there. It's terrible.
There's one company called reship.com. There's another company I'm forgetting the name of, but there are a few services to where it makes the most sense to buy in larger accounts because they do still have to pay a bit for shipping. But what they do is they give you a US address and you buy whatever you want and they send to that address and they then reship to wherever in the world. So there's services like that too that are available.
Yeah, but they have to put they have to list the items in the shipment on the customs form, and that's
okay. I didn't know that. It was still a factor.
You can't list it on the customs form anymore. If it's listed there, it will get grabbed by customs.
Okay, good to know.
You will waste all your money spent on that supplement.
I don't want anyone to do that.
Not give it back. In fact, we'll just keep your whole box. So,
well, thank you for educating me.
Painful. Thank you.
All right.
Have a great evening.
Thank you. You guys can see the sunset over the frozen lake here. It's beautiful tonight.
Look at how beautiful. Where are you at right now?
I'm in the middle of nowhere in the woods in northern Minnesota. And I'm very happy about it.
Yeah. Love the great white north.
Thank you.
Thank you.
Muted myself. There we go. So thanks everyone for being here with us tonight. A lot of you guys stuck around this whole time. That was awesome. We'll have another one coming up sooner. I think we're about like 2 weeks out for the next event and happy to talk further. In the meantime, take great care of yourselves. Bye-bye.